Whatever sort of business you are, there is always the possibility of an accident or damage to someone's health. All work exposes people to hazards. A safe and healthy workplace should be as important as the achievement of any other key business objectives. The implementation of the Abu Dhabi Occupational Safety and Health System Framework and the codes of practice support a safe and healthy workplace for all. Manual handling occurs in almost all workplaces, though workers in hospitals are considered among the most likely to be exposed to heavy loads. Factors that increase the risk of injury include the load being too heavy, large or difficult to grasp, and a task involving awkward postures or movements, and the workplaces lacking sufficient space or poor lighting. Work-related lower back pain and injuries such as strained muscles are the most common musculoskeletal disorders and are usually caused by poor manual handling practices. Poor manual handling techniques can also lead to other injuries such as fractures due to accidents caused by unsafe or unstable loads. Moving machinery can cause injuries in many ways. People can be struck and injured by moving parts of machinery, or ejected material and sharp edges can cause cuts and severing injuries. Injuries can also occur due to machinery becoming unreliable and developing faults, or when machines are used improperly through inexperience or lack of training. By putting in place the correct codes of practice, employers and employees can avoid injuries and the possibility of long-term physical ailments. The Code of Practice for Plant and Equipment requires that machinery is checked before starting, safeguards are in place, and that the person operating the machine is properly trained. A safe working system will ensure that static machinery is properly installed and fixed down, and that machines are not put where workers or visitors may be exposed to risk. A range of physical and psychological abilities in a workforce need to be taken into account when designing plant and equipment that they use and the tasks they perform. By assessing people's abilities and limitations, their jobs, equipment, and workplace and the interaction between them, it is possible to design safe, effective, and productive work systems. Applying ergonomics to the workplace can reduce the potential for accidents, injury, and ill health, and improve performance and productivity. People handling activities can contribute to a number of work-related injuries, including the risks associated with lifting, holding, carrying, pulling, pushing, moving, or restraining people and objects. Most manual handling injuries are preventable through better approaches to managing risks. Employers of more than 250 employees or more require a return-to-work coordinator and are required to develop and implement a rehabilitation and return-to-work program. All employers are required to perform a risk assessment to ensure that employees returning to work or undergoing rehabilitation have the appropriate control measures in place to mitigate any further accidents. Oshad ensure the implementation of the Abu Dhabi Occupational Safety and Health Center System Framework and provide support to those in the workplace who are seeking OSH best practice. Oshad, for safe and healthy workplaces for all.